Welcome to the Pillars of Health podcast. Today we've got Nicci on the show. She's got a fantastic story, so don't miss a second. We are rolling. Welcome to the Pillars of Health podcast.
I love it.
Now, we're pretty new to podcasting, Nicci. You are our second guest.
Oh, wow.
So we're sort of really developing the program and the types of information that we want to get from these discussions with our fantastic community. Mm-hmm. Nicci is most definitely one of our fantastic community members, without a doubt. So it's just a chill out. It's just you talking. You're going to do most of the talking.
Are you sure you can handle me doing all the talking?
Mm-hmm. We've got our soda water. Just be sure that this is not soft drink, guys.
Yes, soda water.
And I was thinking the title for the podcast and various things, whether it should be functional movement based or medical based, and I think I'm going to go with just pillars of health.
Okay.
Pillars of health, because that's what we do here. We focus on foundational, fundamental pillars of health, being the movement, nutrition, stress management.
Yes.
Okay, we can't be stress monkeys.
No.
All the time, because that's going to compromise health, and good quality sleep.
Yes. And I everything that you've just said is highlighted and indoctrinated regularly in the sessions that I attend, and that's what's fantastic.
Yeah.
Centre of excellence, because those are pinnacle in my life.
Yeah, fantastic. So before we get into it, and before you just take us through your journey, we're going to start with 20 questions.
Okay. Hey.
So number one, married?
Yes.
Kids?
4.
4 kids. What are the age ranges?
Oh, okay, big ranges. We've got almost 21, almost 19, and then a 7 and a 6.
Wow. 6,
yeah,
7,
big gap.
6, 7, 20. Wow.
Yeah, same partner. Apparently, I have to say that.
Yes, definitely. If you could pick an age,
yes,
to stay at forever,
yes,
what would it be?
Now,
right now,
absolutely.
So you wouldn't want to be younger than you are now.
No,
you wouldn't want to be. That's awesome.
It's right now.
So you want to milk this time.
I am. I'm really evolving.
You're peaking.
I remember when I first came here to you, just to quickly sum this up, and you said to me, Nicci, there will be a stage where I'm going to interview you. And I was in a bad way. Yeah. And I was looking, what does that look like with the pain and the mental health and the stress and the inflammation, everything that was going on in this journey, and to sit here right now and tell you I've arrived. Yeah. And it's not just with, the movement, it's the nutrition, it's the sleep. It's like, I'm so proud to be here.
So exciting. It's like transform. It's a transformation. And when you look back on it, once you've got that really simple roadmap, it's not that hard, is it? The body becomes amazing.
I think the hardest thing was not having the roadmap.
Yeah.
I always wanted the roadmap.
Yeah.
Nobody could give me one.
Yeah. Every human being is incredible, and the thing that stops them expressing that incredible capacity and ability is just us putting barriers up.
Yeah.
And not following that roadmap. Okay, that's a really cool little diversion there. So back to the 20 questions. You can't get away from the 20 questions.
Yeah. What are we up to?
Are you working? Or are you working at home?
I do a lot of things. I wouldn't classify that I get money for it. I'm a mother of 4. I run a household. I help out a lot at my school, my children's school, and I do a lot of volunteering for other things. So right now, no, I would love to. I'd like to be working here.
You want to be
I'm putting it out there.
Functional movement coach, Nicci. All right. We will keep that in mind, Nicci.
Please.
Now, coffee? Do you drink coffee?
I drink about 2 a day.
Yeah. Do you have a morning coffee?
I have a morning coffee.
Instant pods or espresso?
Espresso.
You make your own coffee, grind
I
it up.
do.
Yeah, fantastic. Tells me a lot about someone.
Oh, does it? Okay.
Do you have breakfast or do you skip brekkie?
Okay, so I learnt through Anthony Power that...
Plug for Anthony Power.
Yeah, no, very good man.
Might get Anthony Power on the show.
Thank you. Yeah, definitely.
Where's his card? I've got his card somewhere.
So please, I hope I'm not saying the wrong thing, but it's overrated to think, for me, to think that, oh my gosh, I haven't fueled yet. No, I listen to my body. And I put good protein and vegetables, or I have my shake, but I don't need it straight away. I'm not hungry. I probably have it till 9 or 10 o'clock.
If you're hungry, you'll have something early. If you're not, okay.
Yep.
Makes sense. Your body's pretty smart. We don't need to sort of.
And I get to ask coaches here too. Always
override our physiological requirements because of modern society's breakfast, lunch, and dinner.
Yes.
Or it used to be.
Or 5-6 meals.
It used
I'm
to
down
be,
to 3.
It used to be, snack and graze through the day.
Yes.
It used to be what we were taught. Okay, if you were playing Trivial Pursuit, do you play Trivial Pursuit?
Oh, holy moly! This is going to hurt my brain.
What's your favourite colour? If you land on a pie to get one of those little pies in your little token. Okay, so it's like art and culture,
art,
or games and hobbies, sport,
sport,
science and technology,
music.
You like those?
Keep the science away. Okay. Give that to my husband.
You like the arty, cultural type stuff. Okay, that tells us a bit more. Are you a dog or a cat person, or not a pet person at all?
I would do both.
You like dogs and cats?
Yeah, I do.
Okay. And if you like dogs,
yes.
Big or small?
French bulldog.
Are they big or small?
They're small.
Smallie?
And I don't mind big ones.
Handbag size?
Oh, I've got a really nice garden, so it really comes down to, will they destroy my lawn and my garden? Okay.
So
that's a very important question there.
Tells the viewers a lot about someone.
Okay. And they'd have to be able to sleep on my bed and not snore.
Right. That has to be pretty small then. Okay. Have you got a favourite movie or television show?
Oh yes, I do.
What's your favourite movie?
My favourite movie is The Razor's Edge. I loved that from a very young age.
Is that an Aussie movie?
No, it's one of those golden oldies.
Okay.
But the meaning in that was, wow, transformed me as a kid.
Okay, I'm going to go get The Razor's Edge. Hope we can watch it on Netflix.
I think Bill Murray did the rendition. Okay. It was the star.
There are a couple of versions.
Remake.
A modern remake from.
Oh, they're in the 80s. I think they did a remake.
Okay, so
The Razor's Edge.
80s is still pretty old. Okay. All right. If you could be really good friends with a famous person, so you can define famous. If you could be like really good buddies, bum chums,
yes.
Mobile phone,
yes.
speed dial.
Yes.
Who?
Deepak.
Who's that?
Deepak, yes, he has.
Chopra?
Yeah.
Deepak Chopra?
Yeah.
Okay.
Yeah.
I don't know why I know that name. I have no idea.
So he does 21-day meditations.
Okay.
And I really
he
love...
must be famous because that just came to my head.
Well, that's
Deepak
to me. I do these 21-day meditations and the centering and what the healing of he talks about, the one that I've just recently done, was the cells will regenerate the body and heal itself every day. But the mind, on the other hand, we have to consciously engage in healing. And we have to use mindfulness, meditation and other things. Yes, I'd like to have a straight, caller to him.
Yeah. Fantastic.
Yeah.
So how do you engage with him now? Like, is it just through TV or YouTube or
no? It could be YouTube. Or? So there's an app.
Yep.
And it's called Showpack, I think. So you've got you can do the opera with Deepak.
Yep.
And I just engage in 21 days, and you can pay. Okay. Sometimes I do the free ones, so I will do the free ones before I. Yeah. Okay. And I will engage in that. It's a 20-25 minute meditation where you listen to him, and then you have to consciously just be present.
And that's an important part of your
mental health,
chasing health.
Definitely.
Yep. It blends into the pillars of health, probably in terms of maybe stress management. That pillar. Controlling stress and
my anxiety.
Yeah.
Also being engaged in being grateful about what I have around me, my family, most importantly.
Yeah.
And I'm wanting to be present for that.
Yeah. A lot of people use the word mindfulness, and you use the word mind. What do you mean by mindfulness?
So sometimes when we're stressed, we think, capacity and demand, okay? And you go, I've got to meet this demand. I've got to be able to do this, and I've got to be, I just want to stop and go, hold on, right now. What's around me? What am I enjoying? What do I love?
Yeah.
what gets me up in the day.
Yeah.
How do I see myself right now? And it's mindful also to engage in being kind to others. It's a whole philosophy of things, David.
So it doesn't have to be related to the actual event, the stressful event that you're in?
I think it would also be also identifying your emotions at the time.
Yeah.
Okay, hey, you're a little bit out of line here.
Yeah.
You know.
Just say the kids are running amok, the younger ones, and they're fighting, and you're just flipping out at home in the lounge room, and hubby's at work and he's busy and no one there to help you. So you're getting frustrated.
So now I'm feeling it. Okay, so I go, all right. I engage in, hey Tyson, I notice you're really tired.
Yeah.
I notice it's a really tough time, mate. Go get Blanky, sit on the couch, let's do some drawing, okay? Yeah. Instead of, on a bad day, it would be, oh, for God's sake, would you just all shut up?
That sounds like us.
Can I have some peace?
Yes, it's my downtime too.
So just try to keep a balance in the home.
Okay, that's cool. I think that gets the message across. All right, now, if you had to teach something to somebody,
yes,
a group of people,
yes,
and you had to teach it really well, what would you teach them?
I would teach them the hip hinge with the broomstick.
Okay, so that's not knitting or cooking and baking a cake.
No.
You would teach them something related to movement proficiency.
Yes.
Fantastic.
Straight away.
That's really cool. All right, are you a morning person or a night person?
Well, David, I'm not you, and unfortunately you need to be a little bit more like me.
Right.
I'm an elite athlete that trains early in the morning. It makes my day.
You're part of the 5 a.m.
It sets my day.
What time do you get up?
4.
4 a.m. You're part of the 4 a.m. club.
Yeah. And I
heard... You start your movement therapy at 5:30.
5:30.
So you go an hour and a half, get yourself ready.
And part of, if you're talking about gratefulness and mindfulness, how you set your day up, straight away for me, will dictate how the rest of my day goes.
Yeah. Very good, okay.
You should join us sometime.
You're not a night person then? Are you in bed by 9?
I'm in bed by 7.
7 p.m?
Yeah. Do you know that Andrew, when people invite us over, Andrew says, look, I'm really sorry, Nicci only plays in the morning.
Nicci's got to go to sleep. We've got to get home.
Yeah.
Dinner hasn't been. We just had the.
I'm a very special person.
We just had the entree. I'm just going to check that we're recording. Sorry about that. Yep, just double checking.
Yeah, very special. I have a very shining knight in armour, my husband, who understands that my regime and routine is really critical for me.
And does that become restrictive, going to bed that early? Like TV shows, and I suppose most things are on demand now, but
no.
TV's not. I'm just using TV as an example.
Yeah.
But,
no, because it just means that the sleep component is crucial for if Nicci's going to be super Nicci tomorrow or not.
Yeah, and sleep being one of those pillars of health, right?
Oh, absolutely fundamental for me.
Are the kids in bed by that time?
The kids may or may not be. They're normally in bed by that time.
Right.
If not, they might be maybe 10 minutes behind.
Yeah.
We read books, sing songs, then I go.
You must have good neighbours that.
We live in acreage.
Oh.
We're pretty good.
So if you're living on a 400 square metre block or an apartment and you wanted to get to sleep by 7 p.m,
they wouldn't like me.
That could be a bit of a problem.
Yeah, they wouldn't like me. I would say turn it off.
All right. Do you like summer or winter? Which is your preferred month?
I thought it was summer.
Yeah.
But it's winter.
You like it in winter?
Yeah,
even though you're part of the 4 a.m. club?
I think because winter is so tough and winter really challenges you to have to get out of your comfort zone. And that's why I like it. Because you have to get out of your comfort zone and you have to be committed. Whereas summer, well, you need to be up early anyway, sun's up.
Yeah. I suppose the thing about winter is that the days are so short and I want to squeeze more into my day. So that's why I like summer too.
Yeah,
and I love, one of the best things is working out and then just flopping in the pool.
Oh, that's nice. See, I don't have a pool, so that's probably why my decision is winter.
Yeah, okay.
Yes, the
All
pool,
right.
nice.
Yeah.
Can we put that on my list of things that
pool,
my
hubby,
husband,
pool. Have you lived in Brisbane most of your life?
No.
Where's your...
I'm a Kiwi.
Oh.
So this will be really interesting.
Right, yeah.
I'm a Kiwi. My father brought us over with my mother, who was heavily pregnant with child number 3.
Yeah.
We had 3 kids. To Sydney, he only had $1,000 to his name to get into real estate. So I lived Northern Beaches. I met my husband at working for him. He was a rowing coach at Cranbrook School, and he was at that stage turning into professional rugby. I ended up marrying him, and he was a Wallaby. So when my family found out that I was marrying a Wallaby, lots of cousins and all Kiwi, they said no. So he was over there for a test, and he gate crashed one of my auntie's 50th, and he said, which one of you said I can't marry Nicci? Then they loved him. That's a great story.
He wasn't going to put up with
No.
Face the music.
But the problem in the marriage, was when we watch the test match, he sits at the corner of the couch like this. Okay, and it's a bachelor pad. So I'd say, to get his attention, oh, that Richie McCall, oh my God, he's good. And then I would get, hey, what? No, he's gay. Because he did, and then I'd get his attention during a rugby match. So it would
Can we fact check that? Do we need to fact check
that? He's not. Right. But it was my way of saying in a rugby match, hey, am I still married to you here?
Yeah. That's cool. All right, look him up, Google him if you haven't.
Oh, the ears.
Yeah. Okay, great story. And so then Brisbane, your kids are never raised in Brisbane and Brisbane for a long time.
Wonderful. We went to France for 2 years to finish Andrew's career, and that was an incredible highlight as well.
Living in France.
Yes.
Amazing. If you could choose any city in the world?
Oh, I'd go back to France.
Yeah?
Yeah, I'd go back to
New
where
York,
we were.
Chicago.
Oh, just to visit
Sydney,
or live?
No, to live.
I'd say France, because we got amongst the villages there. I'd say that only because I know that.
Yeah.
But if you said a holiday, I'd love to go to America and do the Appalachian Trail. But I don't want the bears.
Yeah. Okay. I love Brisbane. And I don't think I need to ask this, active or sedentary? You're crazy active. Favourite sport?
This. Sport of life. I'm going to say the sport of life.
Sport of life.
Okay?
Yep. Fantastic. If you're at the Olympics and you could only go and watch one event, what event would you pick? Summer Olympics, Winter Olympics, I don't care. What event?
Please excuse me for not... what's the one where they ski down the big thing and then they... and then they're in the air, suspended, and then they land.
Yeah.
What's that one?
So just like the luge, not
yeah.
Luge.
That one.
Remember. I think I get. They're really super sly, like death defying.
Up a kilometre.
Eddie the Eagle.
Yeah.
Boom, just boom.
That one.
Yeah.
I want to watch that one.
Okay, that sounds pretty cool. Because it's pretty. It's just
to land from such height,
and we don't get exposed to that type of
no
talent.
Yeah.
All that much every 4 years, eh? Okay. Apple or Android?
Apple.
Apple?
Yep.
Apple computer,
yep.
Apple laptop,
Apple
iPhone.
I don't have the mind for...
Windows.
Yeah, I'm really sorry about that. Yeah, that goes with the artistic flair. Yeah, don't.
All right.
Can't do that.
Okay. All right, I reckon that's probably about 20 questions. I think I skipped a couple, but that's really cool.
Okay.
Let's go back in time then to when we first met, and you came in this office, and tell us a little bit about your journey in relation to functional movement and discovering what we do here.
Yeah. Okay. I'd had an operation. There was 2.
Yeah. Why did you have an operation?
Because I had inflammation, I had biomechanical stress, inflammation, I had breakdown, I had pain and disability.
So you had pain and disability because you didn't know those terms.
I didn't know. I know them now. Okay, so both legs numbing. It didn't matter what I was doing. It was now all the time.
Yeah.
and it was painful.
You had a lot of pain in your back and going down your legs.
Yes.
And this was interfering with this
Everything.
personality of yours of being super active and
Yeah.
just grabbing life.
Yeah, absolutely. It was
How did that affect you? Like, how did that make you feel? Like,
Depression.
As a human,
depressed.
Depression.
Yeah, and I didn't know, and I didn't. Is this it for the rest of my life?
Yeah. And what age was this happening to you?
I can tell you it started from the age of 8.
Yeah.
8.
8.
8.
Right.
So
But you were still doing lots of things.
absolutely.
At the age of,
yeah, but I'm going into
20
now
and-
chiropractors, and I'm going into physios, and I'm going to the Academy of Sport of Narrabeen when I do all my sports.
So
and
if
I'm,
I'd known you at the age of 20 and I said, Nicci, do you have pain? Would you have said yes?
you would, of course.
At the age of 20?
Yeah, from 8 I had it.
As
8.
you've described.
Not the so the tingling. No, but the constant
Across your back.
pain. Yeah.
Okay, but that didn't stop you
No.
doing things?
No.
Okay. When did it start to really actually stop you doing things that you wanted to do? What age?
I was. It was 2 years ago.
Okay.
Mhm.
So in your...
It's now the pain and the tingling's the tingling.
In your 30s? In
Yeah,
your 40s?
I'm 45 now, so for 43 I've had my 4th child.
So in your 40s, it stopped you doing things that you
Yes.
you valued and
Yes.
contributed to the quality of your life.
Everything.
Right.
Gardening, picking up things, picking up your child, sitting down,
Yes.
everything.
And so, what did friends and family think of your
Wow.
inability to do those things? Did they try to help you? Did they
Absolutely.
give you advice,
I've
or-
got very good, such a supportive husband, so supportive. But we didn't know what to do. It's just I went to the.
So what did you do? Yeah, where did you
Okay, so
start?
I went to a physiotherapist who did traction.
Traction.
Okay, I'd go to a chiropractor. In the end, none of these things are
You're
working.
going like every week? Or
Yeah, well, twice.
Fortnightly, monthly?
Twice a week.
Sometimes twice a
Yeah,
week?
twice a week.
Okay.
Okay.
What made you make those decisions? Like just
Because that's all I knew. And people,
they were-
GPs, everyone saying that's who you go to.
Yeah.
There was no remedy except for these are the therapists
Yeah.
that will help you with that. Next thing is to get a CT scan.
Yeah. So you just took the advice of your doctor and friends and family, and obviously
Yes.
you see these places on the street corners, and you visit and tell them your problem. And if it wasn't working, what made you just keep going? Like, why did you
Keep working through it.
Yeah, like why did you feel that you were getting better by doing these things?
No, I just thought, okay, just sit down a bit. You know what? Maybe take some pain meds because I don't want to do the operation that the GP's saying that you do. And I said to the GP, of all the people,
the GP started talking about surgery.
yeah,
because
going to a
nothing-
neurosurgeon, and then
nothing was working.
how many of the people that you sent to a neurosurgeon had success? Not many.
Right. Yeah, that's what he said. He said that
So
not
now,
many people have success.
now I've got nothing.
Yeah.
I've got nothing.
So nothing's working for you.
No,
at
well,
all?
there's no guide. There's no map.
No roadmap,
No roadmap. None. Except
even from your doctor.
even from my doctor.
Yeah. Isn't that amazing? And so many people are in your situation.
And I'm so sorry that if they are in this situation
Yeah.
and they don't know,
Yeah.
pay attention, please.
Yeah.
This is the roadmap.
Yeah. Okay, keep going. So eventually you do go. You you
Okay,
have to start using
I go.
medications
Okay,
and-
I go to the neurosurgeon.
yeah.
I do the MRI because the CT's showing something.
Mm-hmm.
He said at the very most, it looks like a nerve problem. I don't know the terminologies here, but we'll scrape around it. But we've got to do an MRI.
Yeah.
I'm sitting down in his office after the MRI, and he said it's not what I thought. It's worse than that.
Oh, right.
You've got bad degeneration, and there's not much of that vertebrae left. We have to operate.
Yep.
Now, I'm listening to a man who's showing me what looks to be, he's telling me what looks to be exactly what it is, and it's a no-brainer.
Mm-hmm.
And I can't live like this.
Mm-hmm.
So we do it.
So you proceed. You put your trust in him and push on with it.
Yeah.
Okay.
I'm in more pain after the surgery.
Mm.
I'm in excruciatingly more pain, and they don't know what it is.
Yeah.
And they later find out.
So you go back and see him, you have your x-rays.
Yeah, but not, well, I'm in the hospital.
Oh, yeah.
I'm in more pain after surgery, and there's a spinal fluid build-up.
Okay.
But it took a week, and then when he goes in, it hit him in the face. I was like...
Okay. So did you have to go back a second time?
I was still in hospital.
Yes.
But they couldn't discharge me because I was in worse pain.
Okay.
And then the examination showed that there's some spinal build-up, fluid.
Sure.
Okay. Then we go back after the operation.
Yeah.
What are my parameters?
So when do you go home? How long do you stay in hospital?
10 days.
But you didn't have to go back to surgery to fix up anything, that fluid build-up?
Yeah, after that fluid build-up.
You had to go back for a second operation to fix that up?
Yeah, that's right. Okay. Then we go back and
Does
got a
that make
rest.
the pain better? Does that settle things down for you a little bit? Or?
It sort of alleviated the pain, the numbing now.
Yeah.
Okay? We've got no more of that.
Okay.
Okay, we've got some of that, but we haven't got all of it. But it's still symptomatic pain.
Sure.
Okay?
Yeah. You're not thinking, shit, is this as good as it gets?
I don't know yet because I have to let this process happen. Okay?
Yeah.
I don't know yet. I go back to him
Are you worried? Like, are you thinking, just I wasn't expecting this sort of feeling after surgery. I thought I'd be better. You know, like when you go to the dentist and you've got a sore tooth and the dentist fixes up, it feels pretty good the next day, you know.
I'm like this because I'm Terry, because I'm very much hopeless.
Yeah.
I'm very much lost, and I don't. The person I have faith in has none for me.
All your hope into this.
There's nothing.
Massive decision that you've made.
Yeah.
And it's not sort of like it's not Christmas Day.
It's not Christmas Day, and there's no hope. There's no roadmap.
So you go home. How do you cope at home in those first couple of months after this big operation on your spine?
I'm on drugs. I'm on drugs for the pain.
Yeah.
I don't know when I can move. How I've got to just sit.
Yeah.
Sit.
Yes.
Move, and you can walk a little bit. But for
Yes.
me, it's like, no, I'm not walking just 100 metres a
Yes.
day. That's not me.
Yes.
I'm getting up every morning. I'm going to
Yes.
walk 400. Then I'll walk 5. And then he didn't have any parameters, what I could do.
Right.
He just said to me, you'll be back in here for spinal surgery number 2, 3 and 4. But just try and not be in here as early as possible.
But didn't you make the decision to have the surgery so that
I
you
wasn't.
could do more things, not so that you could do less, because you're already doing less.
Yeah.
That's what That's why people.
You didn't tell me this.
Yeah.
You didn't present this on the table.
Yeah, you didn't.
You didn't. Okay, that's
So
where we're at.
It's not really panning out the way that you sort of thought it should be panning out.
It's making the hole bigger.
Yeah.
I can't get out of the hole.
Yeah.
Okay, and now it's going. What's my identity now? This is no moving Nicci. No, from my life.
Yeah.
Are you kidding me?
Yeah.
You know, now
And
my
that-
family. I'm a
That's
dependent
exactly
on my
why you
family.
had the operation, it was to try to
Take all.
get you back to the old Nicci. Okay.
Yep.
Okay, so how many months now down the track are we, where you go back and see the
I had
surgeon?
such a great person who said to me, you need to come and see David Johnson. And I took his advice.
Mm-hmm.
And I got in here, and I thought I would be in the waiting list for weeks, and your team got me in here within a week.
Yeah. So when you came to see me, like you'd already gone to see your other surgeon, and like I'm just going through the mind of a patient, and sorry if you get upset, but when you've had an operation, when you've had an operation with someone else, you've given them the ultimate privilege to operate on your body. It seems, as a surgeon, it seems like to go and talk to someone else means that you've completely lost faith in that person who you just gave the ultimate privilege to.
You know what? I think he even had lost faith in himself because he did not know.
Right.
Seriously. If your surgeon can't tell you what the next step is, well, as a surgeon yourself, what's that saying? It's saying you don't know either. And you didn't tell me that beforehand. You didn't say to me, yeah, you're going to be fine afterwards. You know, you didn't tell me that I'd be back in here for spinal fusion number 3, 4 and 5.
Yeah.
That's disgraceful.
There's a lot to take home there, isn't there? There's a very powerful message there for any doctor or professional in the health industry is being accountable, being accountable for what we do. All right, so you come and see me because you've really sort of given up.
Oh, you know, can I interrupt here though? So I walk through these doors and I'm having a panic attack because it just brings me back to the surgery. Okay, brings me back to the treatment of the whole situation of this doctor, and isn't it just and leave it at that. I'm having breathe, Nicci, just breathe, and I have to sit in your surgery, and I see your gym, and I smell it, and I see Georgia training an athlete, and I calm down, and I just go, is this what is in store for me? Is this? And oh my God. And I had to wait an hour. I'm happy to do that,
really?
man. I'm watching Georgia.
I was running an hour behind.
I don't mind. And I'm watching and going, is this in store for me?
Yeah. Wowee.
That was
so
awesome.
Just our waiting room had a therapeutic effect.
Oh, the smell.
Wow.
The smell of that
movement
gym.
Training centre.
Yeah.
Movement training centre. Wow. Because our waiting room is in the movement training centre.
Tell me a doctor's waiting room with the gym, and I just went, oh, where the hell has he? Where have I? Oh my goodness!
That's fantastic. And I can remember when you came in, there were lots of tears when you
Yeah.
had your first consult with me.
Yeah.
And did you think that? Did you think that I was going to suggest that you needed more surgery,
No.
or that you needed some other procedure? Or?
I didn't think anything except I needed a roadmap, and you were the person that I was told could give me that roadmap. But then you also gave me something that was even more powerful than that. You explained to me why I got to where I was, and I'd never been presented with that. And it was a dysfunctional movement syndrome illness, if I've got that correct. And it made sense. Okay, movement. Yeah. And it was like an aha moment. It was, oh, okay. I've been moving so incorrectly. Yes. I've done all these sports, and it's not because of no passion, it's because I've done it incorrectly. And then you said to me, we're going to rebuild you. Yep. I said, well, when can I start doing it? Hold on a minute, Nicci.
Yeah.
You said, you know when we build a high-rise and you got to put the concrete and the foundation in, that's what we've got to work on first. Yep. Oh, wow. Okay. And that's called NeuroHAB, Nicci. You need to do this. And then from there, we're going to do.
It just made sense to you.
And it was, thank you.
Right.
Gift. It was gift. It was gold.
Yeah, and I think sometimes when you just go through the motions of telling patients how I see it and how I analyse pain, and it's amazing to hear from you as to how that what I see is fairly simple, how that affects the way you feel. It's pretty powerful.
Yeah, and even though I was ashamed, I said to you, I'm really addicted to these drugs. I've got to tell you this. And you said, no wonder. So this man isn't judging me. This man is understanding me. This man's giving me empathy. Yeah. And he said, but that won't, you won't need this. Yeah. And I really appreciated that. Yeah. Oh, that was, wow. I finally found the miracle of this whole centre of excellence, and it's been like that from day one onwards.
Yep, that's great, Nicci. Okay, so we had a sort of 45-minute consult, and then you signed up for NeuroHAB.
I started that very week. That very week.
Yeah. Okay, talk us through rebuilding Nicci.
Well, okay.
Movement proficiency.
Okay, I don't want to reflect on David Johnson's Team Hero staff because they're not. They are excellent, superb, fine. I defy anybody out there that says a PT coach or anything like that. No, these are Centre of Excellent coaches.
They're cherry-picked.
Absolutely. So and that's really remarkable. That's it.
Cherry-picked because of their passion. And their skill
and they've been there too. A lot of them, because Yes. So I learnt about capacity and demand. Well, Nicci always wants to be able to say, I'm going to do this and this and this today, and you taught me, your team taught me, you might want to do that. Yeah. But can your body do that right now?
Yep.
No.
Even if it's hanging out the washing.
No, it can't.
Yeah, exactly right.
So I had to teach my mind this. Yeah. You know, okay, you're going to have to start learning what your body's capable of.
Yeah.
Okay, the capacity and demand, learned that. And the pillars of health, you know, your sleep and nutrition.
Yeah.
And I remember the frustration at one stage, and Luke, I said, what's going on? I know I can do, and Luke said, hold on a minute, Nicci. Luke comes out, pulls up in his phone, the MRI, and he says to me, it's inflammation, Nicci, and it's going to be there for around 6 to 12 months. Expect this to stay like that. So don't be upset about why it's there. Oh, thank you, Luke. You know? And then Georgia just saying to me too, as an athlete, that we are constantly wanting and getting frustrated, but it is a journey and it's a process.
Yeah.
That's life too, isn't it?
Yeah, yeah.
So don't put those expectations.
Yeah. So you knew you were on the right roadmap. Your journey was going to be, you know, relatively lengthy.
Yes.
But you were going to get there.
Yeah.
Before you didn't know how to get there.
No, and when I did something, it was with full velocity, full volume, full passion, and now I have coaches.
In fact, your journey, which we may have thought might have been 1 year, was actually turned out to be relatively quick.
6 months.
Yeah, it's because of your deep understanding of how important
I think
that pillar of health.
Asking the question to and being here every day.
Yeah.
There was no negotiating that.
Yeah.
And I said to myself, I'm not finishing here just on NeuroHAB.
Yeah.
Because I know my personality.
Yeah.
Whatever I choose to do, I'll give it everything, but I'll forego the correct way.
Yes.
Because number one, I don't have that capacity to understand the movement function needed, okay?
Yes.
I only know I'll give you everything. Here, no, Nicci, bend properly, load it, unload it a little bit more, the technique's not okay. So I'm constantly being observed, given instruction, and that is what Nicci needs.
That's part of the difference between exercise or strength and conditioning and fitness versus movement training. We focus on movement skill, and then as a consequence of that, you do become fit. But our priority isn't fitness. Our priority is movement skill, and then movement skill just naturally, unavoidably builds fantastic athletes.
It's like your default.
And
good default.
And tell us what we, think about. Well, I've done lots of things with Nicci outside of work now too, and I was amazed that we organised that Mount Cootha run. This is.
I'm going to put David aside for a minute, because we are so lucky that we get exposed to our neurosurgeon, who won't put his neurosurgeon tag on. He becomes one of us. And that was just one exercise where you took us to, well, I organised it, you came, and it was awesome. So the exposure of your doctor in this community is just awesome.
Yeah. Because look, movement therapy or movement proficiency is for everybody. I don't want to leave myself out of that.
Yeah. That's a good point.
So I want to be a part of that, and I love training with my patients, and I pinch myself that there's John, there's Jack, they used to be my patients, and now I'm doing a NeuroFit workout with them, right? So what else have we done? We've done the handstand workshop.
Yeah, well, that was marvellous.
Like
do you know that I can now do
handstanding?
Yep, I can do a handstand push-ups now. I can do that.
So you're upside down on the wall doing handstand push-ups. So when we program handstand push-ups, you go, I'm RXing. I don't have to scale that one. That's quite a feat. That probably less than 1% of people in the world can do handstand push-ups.
Well, hey, I'll tell you why. Because we've got 2 coaches per 10 people in the class. Yeah. We get such good sound coaching that I lap it up. It's gold. Yeah, movement proficiency. That's probably why I've come a long way, because I'm not in a class of 1 coach and 40.
Yeah, I mean, think about that. Like a year ago, if I said, Nicci, you're going to be doing handstand push-ups.
Oh,
you were happy to bloody be able to do the laundry.
Yeah. Oh gosh, yes, and to mow my lawn. Yeah, absolutely. Yeah, and the coach is here. I mean, they all present with the most amazing assets, each of them. So it doesn't matter what class you go to, you're in great hands.
Yeah.
Captain Sam's a bit mean though.
Captain Sam, pushing your capacity.
Well,
He does that to me as well.
yeah, I just want to dob him in.
Captain Sam, you're dobbed in.
Yeah.
All right. Well, Nicci, anything else? That's a lovely story. I'm really proud of you.
Oh, thanks.
I'm so proud of you. And I'm grateful for you telling your story because there are lots and lots of people like you. And I know what the background science is and the research is, and back pain is considered to be the leading cause of disability on the planet by the World Health Organization. So the statistics don't lie, and what it tells me is that as an industry, we are not doing as well as we should be to help people like yourself. So you're part of that process in helping to get that message out there. And my dream is that people who have back pain will just be driving along the street one day and they'll see a functional movement training centre on the street corner.
Yeah.
And they now have a choice of doing functional movement therapy or having a massage or having Pilates or doing hydrotherapy or going to a physiotherapist. And there's nothing wrong with those other strategies. But as you said right at the beginning of the interview, that you've got to have that foundation. Yeah. That foundation to build your capacity back up on.
That was the biggest takeaway. There's one of the things that we put on the board, okay? And so that's as many as form. It's as heavy as form allows. Yeah, that was on the board, okay? And one of the coaches said, I hate putting that up.
Yes.
Because that should be applied to everything. Mm-hmm. Yeah. Right.
Well, that's the fifth point of the NeuroHAB points of performance, isn't it? Point number 5 is proficiency limited range of motion.
Yeah.
Okay, so if you can't do something and you move out of good positions to do it,
yes,
you've got to modify that activity for a little while.
Yeah.
Until the body catches up, and then suddenly it's okay to pick up a 10-cent coin that falls on the ground.
That's the one that did it, right? The last thing I'd like to say is that I trained with a girlfriend of mine and she is a CrossFitter. Mm-hmm. We were doing deadlifts yesterday and I got her to use the broomstick. Yep. Couldn't do it. And we're doing it. And then the comment she made to me...
Was that
this is her house.
Yeah.
Okay? Yeah. And she says to me...
So you're doing a bit of your own functional movement with your
training.
Friends. Yeah, you're
I'm helping her.
Teaching.
Yeah, and I videoed everything, right? On her 4th go.
Yeah.
Okay, so I've said, she's strong here. She was doing everything up here, but nothing down here. Yeah. Nothing, no hip hinging, nothing. Yeah. She got it right. Anyway, she said to me, I just want to say, you have so much potential as an athlete in CrossFit. And I stopped her there and I said, I am a product of this centre of excellence. That's how I got to where I am today. Wowee. That's the message I want to leave.
All right, Nicci, that's a wonderful chat. I don't think we've gone too long, but that is just fantastic. Thank you so much.
Thank you, and your family and coaches.
And I hope everyone's enjoyed listening to Nicci's story. I've certainly loved having a chat with her, and I hope that we can bring some more stories in the future to our community out there. So have a great day, guys. Thanks very much.